Hi, I'm Jason Bellamy coming to you from Capitol Hill, where today 3 therapy associations came together to testify before Congress and ask to once and for all repeal the therapy cap. Let's start with ASHA, and one of the arguments that you guys collectively made in terms of talking about the impact of the therapy cap was essentially, if you look at a situation like when someone has a stroke, for example, you're potentially forcing them to choose between getting therapy to walk or to talk again. For somebody who's unfamiliar with the impact of the therapy cap, kind of describe why somebody could be put in that situation and essentially why the caps have been or can potentially be so detrimental.
So sure, right now there is a combined cap for both physical therapy and speech language pathology services, and there's a separate cap for occupational therapy services. So for example, if an individual has a stroke, they may need both physical therapy and speech language pathology services. In most cases for a stroke, the physical therapy is going to come first. And so if you have a financial limitation, that means that person's going to come up to the cap, maybe even with physical therapy, and then they're left with not having speech language pathology services. And for the individual, communication needs are very important. If you can't communicate to your physical therapist, if you can't communicate with your caregivers, that is very detrimental, and that it does happen could happen under the cap.
So over the years, Congress has acted 16 times to essentially try to prevent the cap from harming people the way we know it can, and that's a great example. AOTA took steps, commissioned a report to essentially look at therapy utilization, and that was part of the argument in terms of if we're going to repeal this thing, what happened? So describe to me what you found with that report.
Sure. So we had a report that compared 2011, which was before there was any kind of review process put into place, to 2015 when the current review process took effect. And we found that current review process, which we have not heard many complaints about from consumers or providers, really has done its job of controlling utilization. Therapy expenses grew at 7% compared to Medicare at 11%, so we grew at a slower rate. But even more importantly, our per beneficiary spend was negative 8% compared to those 2 years, whereas Medicare, it was overall 8% increase. So we think that that's great data showing that this sort of targeted review process is doing its job in controlling utilization, but also making sure the beneficiaries have access to the services that they need. And we're really encouraging Congress to adopt that kind of permanent review process.
Yeah, so on that note, if we're looking to repeal, if we're looking to let's sort of go on with reform, what are the themes of reform that you talked about today and that the associations have come together and said this is what's important as we move forward?
Yeah, thanks, Jason. The 3 therapy associations have worked together over a number of years, almost 20, and have really identified 3 principles that are essential in legislation to address the therapy cap. The first principle is obviously to ensure access to patient care. So how do we make sure that the patients that need rehabilitation get the rehabilitation services they need, and they get the adequate of those services, so that if they need PT, speech language, and OT, that we're not sort of playing against each other. So that's our first principle. Then our second one really bases off some of the work that AOTA did, and really going with the oversight should be at a targeted medical review process. Broad-based medical review or broad measures such as the original therapy cap just aren't effective. And so how can we be targeted to make sure that the right patients and the right utilization controls are put into place? And then lastly, our policy is to align with where the future of healthcare is going. We need to get rid of some of these old policies. If we're moving toward quality-based or performance-based models and we still have an arbitrary cap or antiquated exception processes in place, it makes it tough to make that full transition to value-based purchasing.
So that's what we talked about here on Capitol Hill today. There's legislation on the table right now to repeal the therapy caps after 20 years. Clearly, these associations feel it's time to move on and move forward and give better health care to Americans who need it. So get involved, go to your associations, find out ways that you can take action.